Hello, everyone. My name is Dr. Wendy Wright. I am an adult and family nurse practitioner with more than 30 years of clinical and leadership experience caring for patients with complex health needs. In this video, I will share how I recommend vaccines to adult patients during patient visits and how my team incorporates vaccination into our daily workflow to maximize opportunities to vaccinate. Before each visit, our team reviews the patient records and highlights any preventive items the patients may be eligible for. As each visit starts, I already know which vaccines to discuss. Preparation ensures vaccination can be part of any visit, not just wellness visits. I initiate the conversation about vaccines by using a strong, presumptive approach. For example, I see you have not received this year's flu and COVID vaccines. We have them here, and the CDC says it is possible to receive both at the same visit. Let's take care of those while you are here. I keep explanations simple, as deep scientific discussions can sometimes feel overwhelming to patients. If the patient is interested in vaccination, I coordinate administration during the same visit whenever possible to prevent missed opportunities. Our clinic also uses what we call the 4I rule, where 2 staff members verify each vaccine before administration to reduce vaccination errors. If the patient is unsure, I ask open-ended questions such as what stands between you and getting this vaccination today. I use active listening skills to show the patient they are being heard, and I respond with empathy, confidence, and evidence-based information. If the patient declines, I acknowledge their choice while restating my recommendation. I understand your decision. My recommendation remains the same, and we can revisit this at upcoming visits. I document vaccine refusals to ensure that the conversation is revisited later, and let the patient know that from my perspective, the conversation remains open. In summary, I recommend being proactive when addressing vaccination, personalizing your message, using strong and confident recommendations, and keeping explanations simple. Remember, we can counter vaccine misinformation through strong, personalized recommendations and empathetic communication. Together, we can use patient-focused communication to support vaccination discussions.